Welcome to today's PAWSCAST.
Well, thanks for tuning in again to another PAWSCAST experience here at Frostburg State University. I'm super excited to have one of the leading dermatologists in our region, Dr. Amy Norton. Amy, welcome to the show.
Thank you so much for having me. I'm glad to be here.
So Dr. Norton graduated from West Virginia University School of Medicine and completed her internship and residency in the university's Department of Dermatology. She specializes in medical and cosmetic dermatology and has a special interest in a lot of different medical conditions, including basal cell carcinoma, contact dermatitis, eczema, impetigo, and melanoma. Dr. Norton is also experienced in the science and art of cosmetics, including a lot of different companies and brands from Botox to some of these things I can't even pronounce.
Like learning a whole new language.
Yes, indeed. But Dr. Norton works at Mountain State Medical Specialties in Morgantown, West Virginia, and Uniontown, Pennsylvania.
Yes.
Welcome again to the show.
Thank you very much.
Yeah, I'm super excited to have you, Dr. Norton. So we're going to get right into business here. I think that, I deal with a lot of health issues on college campus here at Frostburg State University. But the one thing that I've found myself realizing is we don't talk a whole lot about skincare. And I thought, you know what? I think that we need to address that because I think it's a very important topic.
Yes. Well, I'm a little biased, of course, but I think that's fantastic. I love to talk about it.
So our primary audience, as you know, is our college students, but we also send this out to our faculty and staff, and it goes out to the World Wide Web. So I think that even though we're going to focus a little bit on college students, this information is good for anybody really listening today.
Sure.
So let's start off with nutrition. Now, down the road, I'm going to have a registered dietitian join us, but I was just wondering what your thoughts were about how nutrition plays a role in skincare. And are some foods out there that are really good for our skin or some things that we should avoid?
Yeah, I think that's a great question. Quite honestly, that's something that we don't learn a lot in medical school. So I think the focus has come really about nutrition, not too long ago that people really started talking about it. So I think to answer your question, absolutely it plays a role in your skin health. And I think definitely those antioxidant rich foods, the fruits, the vegetables, the things that kind of help our bodies process that free radical damage, which is part of what causes aging, what causes cancer. So I think the more of those clean foods that you can eat, the better. I think also nutrition plays a role. When you eat these high processed foods, they produce more inflammation in your body. So I think things like psoriasis, eczema, these really common skin conditions that we see, if you're eating a lot of these high inflammatory foods, which are those foods that are high in sugar, high processed foods, they can really make your skin worse. The other thing that I see a lot and I get asked a lot in clinic is about your acne. It is absolutely tied to some things, not what mom used to tell us about, candy bars and pop or sodas, but actually, dairy, believe it or not, is tied a lot to acne. There have been a lot of studies that have proven like the hormones that they put in the milk and the dairy products can affect us hormonally and cause acne. So I think, those are things to think about. I think we can, also add good things, not only antioxidants, but vitamin D. If we're using our sunscreen, we maybe don't get enough vitamin D. So that's another thing to think about with diet and nutrition. So to answer your question, yes, I think nutrition plays a really big role in your skin.
Well, I'm glad that you said that because, I like to get my vitamin D, both, being in part of the country that we live in, especially in the mountains of Maryland here, in Western Maryland, sometimes we don't see the sun for a while.
Right, absolutely.
And so we have to supplement as much as we can.
That's right.
But what about sunscreen? I know there's sometimes people are a little controversial about should I use it, shouldn't I use it,
Right.
The sun's good for me, the sun's bad for me. What are your thoughts about that? And how much should I use if I use sunscreen?
Yeah, so I hear this a lot in clinic, and and my answer to that question is wear the sunscreen. We know the sun causes cancer. I mean, it is we just see it every day in our practice. So, definitely wear the sunscreen. We want to get a good SPF, in there. I wouldn't get real caught up in numbers as far as, 30 to 50 is plenty. People come in and want to know about 100 and 100 plus. Don't get too caught up in that. But, definitely, wearing the sunscreen. I would be more concerned about not wearing sunscreen than wearing it as far as causing cancer. For sure.
Okay. All right. So what if someone, would say, hey, I got some new moles or some growths or some changes on my skin. I assume that's something that's to be concerned about. How would you address that?
Yeah, so I tell people, things to watch for, things that aren't healing properly. So I think the most common thing that people come in and say is, hey, I had this pop up and thought it was a pimple, but it's been here for 3 or 4 months. It bleeds every time I wash my face. Even when I don't do anything to it, it's bleeding. That's a red flag. If something's not healing, it's growing, it's bleeding, those are definitely things you want to get checked out. Those are more fall into the categories of basal cells and squamous cells, but melanoma is the one that's classically something that looks dark. So if you have anything that looks black, it's really standing out. It's a mole you might have had, but it's changing. Those are the definite red flags that you want to get checked out. So I feel like, you know your body better than anybody. If you feel like something is not right, get it checked. I think that's the best advice I could give someone, because I can't tell you how many times people have let something go and they shouldn't have. And then that gets them into a lot of trouble potentially. So if you have a question, get it checked out.
Okay. So what if skin cancer runs in the family? Does that put someone at a higher risk than another person with no skin cancer?
It does, particularly. So with melanoma, it's your first degree relatives. So it's your mom, dad, brother, sister. If they've had melanoma, that puts you at a higher risk of melanoma, because there can be a genetic component to melanoma. With basal cell and squamous cell, I think it's more of you inheriting the skin tone that you have from your family. So, maybe, you come from a more fair complected background. That's going to put you at a higher risk of something like that. So yeah, family history definitely comes into play. Your history of sunburn before you're 18 is what really plays a critical role in melanoma, particularly. It raises your chances tenfold if you've had a blistering sunburn before 18. And so many of us did, as kids growing up, before sunscreen was really used as readily as it is now. So, yeah, I have family history, but also just your skin tone and those other things that you may inherit and how much sun exposure you got as a kid.
One thing that I was just thinking as you were talking, and probably should have as a follow-up question when we're talking about the sun, what are some things that I need to be looking for if I've had some damage and I need to get it checked out?
So if you've had sun damage and like maybe you've had some blistering sunburns, again, it's those things where, you'll have some pigmentation changes. That's often the first sign that you've had a lot of sun exposure. You get that freckling, you get that look of, you can almost draw a line. A lot of people that I see can almost draw a line right where their shirt, ends here, and they're getting most of their sun here. And then I see that left side from the car, you don't even think about it. But my classic thing that I tell people is this sun that you've gotten from the time you were a kid is like drops in a bucket. You collect it. There's nothing you can do about, we can't go back and change all that sun that we got as kids and teenagers, but it's going to come out as damage, as that freckling, as that change in pigmentation. And again, you'd look in those spots for anything that might be bleeding, growing, dark, anything that just looks like it stands out. It's literally that ugly duckling rule. If it looks like it's not supposed to be there, you want to get it checked out. Okay,
good advice. So, remember our college days, they were stressful at times.
Yeah.
So, when I talk to college students, it seems like they're stressed out a lot of times these days. Some more than others, but does stress have an impact on our skin?
Yeah, it does. It does. And my joke is, gosh, if I could write myself a prescription for no stress, I 100% would, and the line would be down the street if I could do that. So, there's definitely other ways that you can have outlets to deal with stress. Maybe you meditate, maybe you work out, maybe you take a walk, things like that. So you can do things to help alleviate stress, but I know we all have it regardless. But yeah, I mean, it definitely affects acne. I see that all the time. And other inflammatory conditions, because again, your immune system is very closely tied to your stress level. So when your stress goes up, your immune system sometimes goes a little haywire as well. So you can get more of that inflammation. So I see psoriasis get worse, eczema get worse. There's definitely stress-related autoimmune things, like alopecia, where you can lose hair. So, stress can really affect lots of different parts of your skin and hair.
Hmm. I was thinking of my older son, and he didn't have a serious acne problem, but he had a little bit of an issue growing up.
Mm-hmm.
And two things that you talked about kind of reminded me of some of the things that he's been going through. One, you mentioned about, dairy-free being pretty important for some people.
Mm-hmm. Mm-hmm.
This past year, he lost about 75 pounds just going dairy-free.
Yeah.
And so proud of him,
That's something. Wow.
But I also noticed that his skin is looking better too.
Mm-hmm.
So it's interesting that you said that. And I know that being my boy, I've watched different times in his life when he's been stressed out, and he will break out from time to time.
Absolutely. It is a real thing. People will come in and they'll say, I think it's stress, but I know it's probably, that's probably not true. But I see it all the time. It happens too much for it not to be a factor. And again, even with hair loss, when you have autoimmune hair loss, I've seen people have a big illness, surgery, maybe a death in the family, like something really stressful happens. And the way your body handles that and the way your immune system processes that can be so different. And you have people lose patches of hair, from stress. So it is a real deal.
Yeah. So this next question deals with the seasons. We're fortunate to grow up in a part of the country where we get to experience the 4 seasons.
Right.
Now, sometimes it seems like we only have 2 seasons, with
Winter
fall and
August.
spring being so short,
Right.
But it's pretty cool to kind of see this time of the year, the leaves changing, the temperatures dropping a little bit, and so forth. I'm just curious, as the seasons change, does that have an impact on our skin, number one?
Yeah.
And number two, are there things that we can do as we anticipate new seasons coming along to kind of help our skin?
Sure. So your skin barrier is what plays a role in protection. So as your skin barrier dries out, particularly we're getting into the season where we get drier, the humidity in the air is lower. We turn the heat on in our house. It's usually a dry heat, and that's going to dry your skin out. So as your skin dries out, it can't protect you as well. So things start to irritate you more. So we definitely see eczema get a lot worse in the wintertime. And some people are good during the summer and bad during the winter. Psoriasis usually gets a little worse in the wintertime as well. So dryness is definitely something you can try to do a few things to try to help. Staying hydrated, and drinking as much water as you can. And then stay, moisturized as well. So trying to moisturize with something, preferably not something real fragranced. So the boring stuff is better. So things that don't have fragrance, things that don't have a lot of perfumes and dyes. I'm guilty of this, but taking super hot showers dries your skin out. So, that's another thing to try to stay away from, particularly in the wintertime if you can. Moisturizing as soon as you get out of the bath or shower, right after you towel off, is when your skin's really going to absorb that. So fragrances, limiting that, and moisturizing and hydrating in the wintertime can really help you. But that's the biggest shift that I see in skin, is that fall to winter kind of dryness level that can really impact your skin barrier.
That's a great response. As you were talking, I was thinking about, I just was doing some reading about cold showers. And I agree. I love a hot shower. I know. I love the hot shower, especially on my neck.
I know.
But what are your feelings about the cold showers, even if it's for a couple of minutes, and kind of building the immune system? And
yeah, I haven't read the study, so I can't really speak to scientifically really if that has any merit to it. But I've heard, people are talking about it's kind of like the cool thing to do. Again, I don't think I can speak to it scientifically, but definitely, I know it doesn't dry your skin out like hot showers do. So if you can take a cooler shower, it's supposed to be better for your skin.
Yeah, I would agree with that. And I was just, kind of pondering that. It's kind of scary to think about taking cold showers. I have a niece who started to do this summer. Now she claims that she feels a lot better.
Yeah.
So I guess time will tell.
Oh gosh, I just don't think I can do it. I don't think I could. But it's all gotten a lot of buzz for sure.
Yeah. So this next topic I'm not really familiar with, but I've dated some, females in the past that have experienced exfoliation.
Yes. Yeah.
What are your thoughts about that? Is it good for the skin? Not so good for the skin? Does it depend on the person or?
It definitely depends on the person. It depends on what skin type you have. People that are super sensitive, maybe they have rosacea, maybe they have eczema. Those are conditions where you're inflamed, you're irritated. Exfoliation is just going to make you redder. It's going to make you more inflamed and more irritated. So you have to be a little bit careful. If you have a normal skin type and you're wanting to maybe just kind of help give your skin a little more of a rejuvenated, refreshed look, yeah, you can exfoliate once or twice a week, but I wouldn't be exfoliating every single day. You can really, again, we talked about skin barrier earlier with being your protection. You are disrupting your skin barrier when you do that too often. And then you're going to be sensitive. You're going to maybe break out more. You're going to cause more problems than you're solving with that. So my answer to that would be once or twice a week. If you have normal skin, plenty.
Okay. So, there's all kind of skin products that are out there. I mean, every time that you go to, a drugstore or, Walmart or, wherever, it seems like something new's
It's
popped
overwhelming.
up. It really, it's like going shopping and, you used to have 2 cereals and now you have so many to choose.
Yeah.
So with all the skincare, trends and products that are out there on social media, how do you kind of discern what's credible and what's not?
Yeah, it's hard. I mean, and again, with TikTok and all the things where people come out and they, you think they know what they're talking about, and maybe you look and they're just a normal person that's decided to, come out there and tell you what they're doing. I think you have to be careful of your source. I would make sure that you're listening to the right people. People are usually selling things, so you have to be a little bit careful with that online. But I think really just what I tell my patients is we get hooked into this thing where we think we have to be doing 16 things a day to keep our skin good. We have to be spending a lot of money because if it's not an expensive product, it's not a good one. And I think that's a complete, we've been kind of brainwashed into that. So simple is better. I'm a big believer. I've had people bring in shopping bags full of products and their skin's a mess and we don't know what's what, and they're using a million different things and spending hundreds and hundreds of dollars. So I think really just being simple with it, where you find a cleanser that you like and don't spend a lot of money on cleanser. It's a complete gimmick and waste of money. Find a cleanser that you like. I don't own stock in any of these companies, but CeraVe, Cetaphil, Vanicream, those are good options. They're gentle. They do the job. You do them morning and night with your cleansing. You use your sunscreen in the morning for sure. That's a where you want to, spend, your 10, 12 bucks on a good sunscreen. You want to make sure it has zinc or titanium in it. You want to make sure there's a physical block in your sunscreen. I know we talked a little bit about numbers earlier, but that 30 to 50 zone is where you want to be with a physical block in your sunscreen. And then, if you need to moisturize, if you're more on the drier side, I would find, again, a moisturizer, probably something that's oil-free that won't clog your pores. And again, something that's, not super expensive is absolutely fine. And then at night, I think the biggest thing for, that I hear about from women, we start to get concerned about aging and helping our skin look as good as it can. Retinol, which is what your over-the-counter version of things that we write prescriptions for, is a good jumping off point if you're getting started into something like that, because that stuff can be a little bit drying and irritating. But find a good retinol, and there's several that you can go to Target and buy. Rock, is a really good brand. La Roche-Posay, another really good brand that you can find at Target. So 10, 12 bucks, you're getting good things. And then moisturizing at night, probably on top of your retinol, or if you've got prescription tretinoin that you're getting from your dermatologist, put it on top of that. So really that's your starting point. That's your basic stuff, your moisturizer, your sunscreen, your cleansing. You're doing all the things and not spending a ton of money and trying to do 16 things a day.
Yeah. I was thinking this past summer, didn't have a whole lot of time to get away for vacation, but
Mhm.
ended up in rural Ohio,
Mhm.
of all places,
Yeah.
just to kind of chill, for a couple of days. And long story short, the hotel that I was staying at, they had this Dove
Mhm.
body wash, and I
Mhm.
noticed that the water was extremely soft. My
Ah,
my skin was in great shape
yeah.
after 3 days being there. You, we're not promoting any products here,
Right. No, I don't get
podcast.
anything out of mentioning any of the
Yeah,
stuff that I
right.
mentioned.
But I mean, I found that product worked really well for me, so I tend to
Yeah.
use that. But I'm wondering about the water.
Yeah.
Is there anything out there that's saying that, okay, so I have soft water that's great for my skin, or oh
Yeah.
my water's kind of hard. It's kind of hard on my skin. I mean,
Yeah.
what are your thoughts?
Yeah. I hear that all the time. I have people that sometimes will buy a shower head, that fits on
Mhm.
people that have eczema that really deal with this really dry, just skin that is really sensitive. Getting a shower head that just softens the water even. I've had people do that. So yeah, I mean, all those additives that they put in the water can be very drying to the skin. So
Yeah.
if you didn't want to spend all the money in a water softening system for your house, you could just there's an attachment you can buy for your shower head that softens the water. So I have several patients that do that have eczema.
Yeah, we're really considering that,
Yeah.
based on our
Yeah.
experience that we had this past
Yeah.
summer.
Yeah.
So growing up, thank the Lord, I didn't have any problems, with my skin per se as it relates to
Hmm.
acne. I had some
Yeah.
friends that did.
Hmm.
What's the scoop? Why do some people get acne?
Mm.
Other people, don't get acne,
Yeah, it's a really good question. So it's really a lot of things. So it's genetics. If your parents dealt with acne, you might be more likely to deal with acne. It's your oil production, so something called sebum that your oil glands make naturally. Some people make more. Stress, like we talked about earlier, can be a factor. Diet, like we talked about earlier, can be a factor. If you're playing sports, you're sweating a lot. Maybe you're lifting weights, going to the gym. That's that perfect, when you sweat, that perfect environment for bacteria to grow
Mm.
and cause inflammation. Hormones, women, as we go through those ups and downs, those changes in our hormone levels, that feeds acne too. So you can have hormonal conditions like PCOS that can make acne worse. That's polycystic ovarian disease.
Mhm.
So there's lots of different factors for acne. But what I will say is it's not your fault. People will come in saying, but I wash my, I do everything. I clean my face. I'm not doing skincare. Sometimes it has nothing to do with that. It can be just your natural oil production. It can be other hormonal things that you can't control that are contributing to your breakouts.
I didn't grow up, with my wife. I'm a Pittsburgh boy. She's a Frostburg, Maryland girl. We met
Yeah.
in West Virginia College.
Yeah.
And so I didn't know, what was going on with her as a high school student, but she informed me that she had acne pretty bad as a high
Mhm.
school student, even in middle
Mhm.
school.
Mhm.
Her dermatologist prescribed, I think it was tetracycline.
Uh-huh.
And I know now she has some long-term effects because she took so much of that drug.
Mm.
What are some effective treatment modalities that you've found that really works for acne?
Oh, wow. So, you can do topical things for acne sometimes. So you can do topical antibiotics that are anti-inflammatory. You can do benzoyl peroxide that's very effective toward that acne bacteria. Um, retinoids, things that reduce the pore size, reduce the sebum, the oil, so many things. I mean, we still use antibiotics, although, we try to get away from that some just because now we know about antibiotic resistance. We know how important the gut is to our health. So we're wiping out the good bacteria, we cause more issues. So there's some little cheats that we can do with very low dose antibiotics where it's not enough to wipe out the good stuff. It's just flying under the radar of being anti-inflammatory. So it helps us in that regard. So we still use antibiotics some. The big gun, if you will, with acne is still Accutane, which is a derivative of vitamin A. It's been around for, I think, since the 1950s. Those are for people. That's for people that have gone through all the other options and maybe they're scarring. Maybe we're trying to get ahead of it fast, where they don't have permanent scarring for their acne, or they haven't done well with the traditional treatments. So that's an oral medication that we still use. There's also a laser now that does the same thing as acne by reducing the size of the oil gland, and that's called an AviClear laser. That is a treatment modality for acne now that's doing very well. So we have a lot of options.
I didn't realize that you had so many options. That's good to know.
Mm-hmm.
Yeah. So as it relates to moisturizer, I know that going into the winter, my skin begins to dry out, especially the bottom of my feet, my heels, and my elbows are two areas that really hit me pretty hard.
Yep.
I remember growing up, my grandma, God rest her soul, she actually used, you remember Vicks?
Oh yeah. People
Vicks
still
rub?
do. People still
Now,
tell me about Vicks.
She had emphysema, but she swore by Vicks it was a cure-all for everything, including moisturizing her skin.
Yeah. I have people do it. You know what Vicks really does work on?
No, tell me.
Toenail fungus.
I think I just heard that. Wow.
It does. It does. You have to use it. I mean, it's not quick, but people love that option, especially people, that don't want to take oral medication.
Right.
They don't want to have the liver side effects, which we have to check on that. And it's a pretty protracted treatment where you have to be on it about 4 months. So it's not a small thing. So some people opt to do home remedies, and Vicks is still one of those things that really does work if you do it diligently.
That's pretty amazing. Are there some other moisturizers that you found to be a little bit more effective?
Yeah, so I think CeraVe is one of the brands that we recommend a lot, again, because it doesn't have a lot of the fragrance. You want to stay away from all that stuff. It has ceramides in it, which is what your skin makes naturally. So I tell people, it's not just like you're rubbing lotion on. You're actually replenishing something that your body makes to hold on to moisture. So something with the ceramide in it. If you're really, really dry, like how people will get the extra kind of layer of skin, maybe on the feet, the heels, the cracked hands that are really thick, you can get acids in lotions. So like a lactic acid or a urea or things like that are built into a moisturizer that can help really exfoliate some of that dry, thick stuff off the surface. But just for your regular everyday moisturizer, like after you towel off out of the bath or shower, CeraVe is usually the one that we recommend as dermatologists.
Yeah, I was going to ask you, evening and morning, or just evening, or?
You could do it. You could do it as much as you need to. If once a day is enough and that gets you where you need to be, certainly you could get by with once a day. But something like that, there's no limit. If you want to do it 3 times a day, you could. It's just people are, we're busy, and in my experience, it's hard to get anybody to do anything once a day, much less twice a day. So I'm happy with once a day.
Okay. Yeah, sounds good.
Yeah.
So let's focus on guys a little bit. Not that females don't have an issue with this problem, but like a lot of times you'll see us guys, with like puffy eyes or dark circles under our eyes. What?
Gosh, now you're asking me the tough questions. So this is a really common question I get from like you said, both men and women. It's a buildup of, when we get thin skin under here, the blood vessels are a little more closer to the skin. One of the byproducts in our blood is bilirubin, and that's something that can cause that staining or that darkness. That can be a genetic thing too. If you've seen it, your mom, your dad, sometimes that can carry through. It is a tough thing to fix. People ask me about that all the time. I have never been blown away by any product that says that it's going to reduce your dark circles. There are things out there that sometimes when people ask me, well, what could I try? There are a couple things that sometimes I'll tell people about that's just over the counter. But again, I'm not real super impressed by anything with dark circles under the eyes. That is a tough problem to fix.
Yeah. I know, firm believer in the genetics as it relates to that, because I saw pictures of my daddy and my uncle, and man, they've got it.
Yeah, it's tough, but I would just be cautious, if people try to tell you, hey, we can laser that, we can do this, that, the other, I'd just be really skeptical of that, because what I tell people is, if we could fix it, nobody would have it. I mean, it would be something that everybody would know about. We'd be using it, we'd be promoting it. I just have not, particularly things topically, I have not seen any utility in a lot of that stuff.
Yeah, yeah. Now, I think that you kind of answered this question, but I'm going to ask it anyhow.
Okay, no
Do
problem.
dermatologists see patients for hair or nail issues?
Yeah, we do. So dermatology is skin, hair, and nails. So yeah, we see patients for all those things. So we treat fungal infections of the nails, bacterial infections of the nails. I've seen melanoma under a nail. So
Mm,
that is not something that happens often, but she was probably in her 20s. So your college crowd should listen. Um, Girls all the time go for the manicures now, where you put your hands under the light for the gel nails. We're
yeah.
seeing a lot more cancers of
Oh,
the
wow.
hands and nail unit because of that light that you put your hands under. That's still UV. So over time, if you're doing that, consistently, you could be really increasing your risk of certain cancers. So I have seen melanoma under the nail. So one thing about that is, we talked about dark things. You drop something on your toe, if you smash your finger in the car door, that blood looks black. It does until it grows out, but it's going to push out from the bottom as your nail grows out from the bottom.
Right.
It grows out from an area under the cuticle called the matrix where the nails form. So that darkness pushes out gradually. So you should see that darkness grow out. If you don't, or it grows out with a streak, like maybe you have a line that's coming out, or there's pigmentation around the skin around the nail, never ignore that. That could be a melanoma.
Okay.
And then hair, we see hair loss. That's a problem for women. When we get into menopause, perimenopause, hair thinning, we have some options for that now that we didn't used to for women. Um, Alopecia, which is a hair condition that we see from hair loss from an autoimmune condition. So yes, we see and treat all those things.
So I give my wife a gift certificate to get her nails done
Yeah.
every Christmas. It's kind of a traditional gift that I give her.
Mm-hmm.
So I
Don't
guess
stop
I
doing that. Don't stop doing that. Just tell her not to put her hands under the light.
That's what I was going to say. Make sure that it's not under the light.
Yeah, right, right. There's ways to do it that you don't have to do that.
Okay. All right. So can you look into the camera and tell our college students, what's really the best way to care for your skin at this age?
Sunscreen, full stop. At your age, if you are in your late teens, early 20s, trying to protect your skin, not going to a tanning bed. I still see young people going to tanning beds.
Mm,
It's awful for your skin. And a lot of times I can get them to listen to me a little bit more when I talk about, we've all seen the women and men that
mm,
have baked themselves in the sun and what they look like. They look 20 years older than probably they should. So sun ages you
mm.
100%. I see it all the time. Then you're down the road in your 40s and 50s trying to fix all that. Then you've got the skin cancer portion of that. So that is a really important thing. I think, like we talked about, the drops in a bucket. So I would use something that's built into something you're putting on every single day. So if you've got a moisturizer that you're putting on, just make sure it has a sunscreen built into it and you're done. You don't even have to think about adding something else to your day or your routine. If you start doing it now when you're 19, 20, in your early 20s, it's going to make such a difference for you down the road. I'm practical. I know they're going to be outside. They're going to be doing stuff. You're going to get sun. You can't, tell my patients you can't live in a bubble. You can't do it. But not burning is so important. If you cannot burn, don't go to a tanning bed. Just try to protect your high exposure areas like your face, your neck, those places. For guys, your ears. Even if you have a ball cap on, your ears are still really getting a lot of sun damage, and that's where we see a lot in men.
Mm.
So wearing a hat for guys, protecting the ears if you're, out there doing sports, playing golf, this time in your life when you're young, you're not thinking about all the stuff that can happen down the road. I remember being that age.
Right.
But if you do it now, you'll be so glad you did later.
So how often do you think one should go to the dermatologist?
I think that's a question that has a couple different answers. So if you have a strong family history of melanoma, like we talked about earlier, maybe your mom had melanoma, a first degree relative had melanoma, you should go once a year and get somebody to look. She wouldn't believe the times that I've had people come in, maybe they came in for their acne and I'll say, hey, can I just peek at your back? And they have a skin cancer. So if we find these things early, even melanoma, if we find it early, completely curable. It's when things are let go that things get scary. So if you have a strong family history, I would come once a year. If you have a history yourself, so people that have had a skin cancer, I see them twice a year. People that have had melanoma, if it's a melanoma within the last year, I'm seeing them every 4 months in my office that first year after a melanoma. So if you have a lot of moles that, maybe you can't see on your back, at least come once a year. Even if you don't have a history, maybe come just for a look, and if you don't have a history, we don't find anything, then I may say, hey, call me, let me know if you see anything. But otherwise, if you have a history or strong family history, I would come once a year at the very least.
Great. So as we kind of close out the podcast, are there other thoughts that you might have, something that you really want to kind of challenge people or encourage them?
Thanks. Yeah, I just, I'm harping on the sunscreen. I'm sounding like a broken record here, but I think the most common misconceptions, and we hit on this a little bit, is the SPF. So people get really focused on this number. And when you look at the curve for sun protection and SPF, it's not linear. It doesn't go like this. It goes like this. So it flattens out. So after you get to 30, you're at the flat part of the curve. So I feel like when people put on, they make 100, they make 100 plus. People think, gosh, I'll put this on. I'm good all day. I should be good. Those are the people that get burned because they're not reapplying it every couple hours like you should, especially if you're swimming and sweating. So I think that's a really common misconception. So 30 to 50 is a great number to be at. But also we mentioned earlier that physical block in your sunscreen, that zinc or titanium is really important. You don't have to have both, but one or the other. Zinc, they've made a lot better than it used to be. It's micronized now, so you don't look pasty white when you put it on, which is nice. So it rubs in a lot better. It doesn't feel as thick and greasy. So find one that you like and use it. And don't forget to reapply it when you're out there. So that's my big message on sunscreen.
Excuse me. Yeah, thanks. That's great. Yeah. That's great. Thank you so much. So as we conclude then, if somebody has some questions or they feel like, wow, I'm really impressed with Dr. Norton, I'd love to make an appointment. How do they do that?
So we are Mountain State Dermatology. So we have locations, quite a few locations, but I'm particularly in the Morgantown location, which is on Scott Avenue. And then I'm in Uniontown, Pennsylvania. Mary Higginson Lane. I had to think about that for a second. And then if you just Google that, I don't have the phone numbers memorized. But give us a call. We have online scheduling, which makes it really convenient. So if you find us online, you can schedule right there.
Well, Dr. Norton, it was wonderful having you on the podcast today. We certainly appreciate you and all that you do to make a difference in people's lives.
Thank you. I appreciate that. I love my job, and I appreciate you having me on.
Well, thank you, folks, for tuning in to another FSU PAWSCAST. We're so glad that you could be with us today. Again, join us the next time. And in the meantime, healthy choices equal healthy lives. Have a great day.
Thank you for being a part of our PAWSCAST. This health and wellness podcast is brought to you by the Prevention Center and Peer Education Network at Frostburg State University. If you would like more information about our programs, visit us in Pullen Hall, room 109, or call us at 301-687-4761. Or you can always send us an email at safeoffice@frostburg.edu. Remember to watch our other episodes and stay tuned throughout the semester. Thank you!